Hi, this is Dr. Nagin coming to you from Marathon Physical Therapy. Today I'll be recording a video for you if you suffer from lumbar stenosis pain or sacroiliac pain. That tends to be pain in your backside, and sometimes it's even lower, right in the upper buttock area, and it can refer pain down into both your legs or one of your legs, and oftentimes it's like a vague pain. Makes your leg feel tired, and it can give you a lot of disability with being able to walk a long distance or stand for a long period of time. So I have 5 exercises for you, and then last I have a stretch that can give you relief if your lumbar stenosis pain is really acting up. Okay, exercise 1 is done lying down. It's an isometric exercise, so that means it involves just like a hold pressure and not so much movement. So it's going to go like this. One leg is going to be wanting to drive up, and one leg is going to wanting to be driving downward. Okay, so this one's a little bit tricky because you're doing different things with your arms and your legs. So I'm going to start with a push with this leg up and a push down with this leg. So each push counteracts the other. You're going to hold them for 10 seconds while you continue to breathe. So you don't want to hold your breath at any one time. And then you simply switch. So now, pushing this way with this leg, and I'm trying to pull up this way with this leg. Same thing, 10 seconds. And then you switch again. So you want to do a total of 5 repetitions each way, so it totals 10. Okay, second exercise, similar to this one. You're going to bring your legs up, or if you can reach by doing a nice crunch, you're going to reach to the sides of your knees, and you're going to want to push your knees apart nice and strong. This one, same thing. You hold, but continue to breathe. And then you switch your hands, you make 2 fists, you bring them together, put them between the knees and squeeze in nice and strong. Almost like you want your knees to break your hands. 10-second holds with these as well. 10 times. These 2 exercises help to mobilize your pelvic bones. And that's important if you have any sacroiliac pain or SI joint dysfunction. Okay, the next one is a stretch for your spine. So I'm going to go ahead and sit down. Now, if I find that, or if I'm told that I have stenosis that's worse on my left side, or I get more pain just located to the left side of my back, or referring it down into my left buttock or my left thigh, I'm going to want to stretch the left side out. So I'm going to start to lean to the right, okay? And that's going to be one of my stretches. So I'm going to lean to the right, come back. And each time I lean, I want to try to go a little bit farther. You don't have to hold it for too long, but you're going to do 20 repetitions. Okay, you might find it helpful, as long as you don't have any shoulder problems, to grab a towel and help direct your stretch over, because this arm ends up helping to pull you up and over. Keep both feet on the ground. So this is helping open up this side. Okay, 20 stretches to my right side. The next one, similar. You're going to clasp your hands, lay them right on the top of your chest. And what you're going to do, if, again, you have more pain, or you're told you have worse worsened stenosis on one side, so I'm going to pretend it's my left side. You're going to twist to the right. Okay? Go as far as you can comfortably, and then go an extra bit to get a stretch out of it. So your goal is to improve your range of motion. This you'll do 20 times. Feet flat on the floor, good control. Each twist to the right, I want to go just a little bit more. Okay, next exercise, I'm going to grab a mini band, loop my legs through it. And now my goal is, if I've had referred pain or any pain from the stenosis referring down into one of my legs, I want to work out some of the muscles in this leg. So what I'm going to do is I'm going to just open apart, okay? If the resistance is pretty good, you want to use both legs. You want both legs to push into the band. Good, so we're going to do 30 repetitions of this, and we're going to do it 2 times, so it's a total of 60, because we really want to wake up the muscle and reactivate it. If you find that on your painful leg, if you open up against this resistance and it hurts, just go shy of that. Okay, so go halfway or go 3/4 of the way. If it hurts entirely, what you're going to do, you're going to have your other leg pull apart, have this still. It's still working because it has to give resistance to this leg, but it's working it in more isometric fashion. So it turns on the muscle, but it doesn't make it work too hard, so causing discomfort. Same repetitions, 30 times, and you do 2 sets of those. Okay, last one. So I'm pretending I have stenosis on my left side. Okay, I'm going to grab a thick pillow. I'm going to place it next to my right hip, and then I'm going to sleep right over it. And what that does, it kind of already pre-positions my spine into a little bit of a stretch, just like I was doing reaching to the right. And now I'm just going to twist to my left so that I'm looking at my ceiling, and I'm just going to hang out here. And this type of stretch, it's really more positioned to give relief to the left side of your back. So you just kind of hang out here for about 5 minutes, and you see how it feels. You see if it relieves some of the discomfort that you have in either your buttock or your thigh or anywhere in your leg. And then once the 5 minutes is up, you just kind of come out of it nice and easy. So I may just kind of rock back and forth a little bit, and then eventually just sit up and see if that gives you a little bit of relief from any sciatica pain or pain shooting down your leg. Okay?